Hello, my name is Erica. I'm a credentialed cardiographic technician, and I'm going to be doing your stress test today alongside the nurse practitioner. And I've been doing this roughly about 5 years. Before we get started though, can I have you verify your first name, your last name, and your date of birth?
Carolyn Navi, 22654.
Perfect. And then I'm just going to verify wristband and make sure it looks good. Thank you. So the test itself, the duration does end up being about 30 minutes to 40 minutes. And then we'll go over some things because this test does have you acknowledge and we go through an informed consent. So essentially, going through this, you're acknowledging that your physician has ordered this test to assess your cardiac status, and then also your participation in the test is voluntary. So I'm going to clean and prep that area on the chest for the 12-lead EKG. To do that, I'm going to be cleaning with alcohol different areas on the chest, and then we'll slightly or just lightly abrade the areas as well and apply electrodes. Those electrodes can cause some irritation, but that is normal. Now during the test, it's going to be performed on an actual treadmill. The speed of the treadmill and then also the incline of the treadmill, they're going to progressively increase throughout the test, like gradual by gradual. So it gets harder to do as the test goes on. But it is important that you try to exercise as long as you can for the test because it does improve the diagnostic accuracy of the test. Now during the test, we're going to be monitoring your EKG, your blood pressure, your heart rate, and your heart rhythm. But if you are noticing any unusual symptoms, like if you feel chest discomfort or you feel lightheaded, you're going to want to let us know. Also, if you feel like, oh, I can't go any further, I'm tired, I'm exhausted, also you want to let us know. Give us a little bit of warning so we can get our measurements before then. Now there is a slight risk with the test. So essentially you're acknowledging there's a slight risk of abnormal symptoms that can occur during the EKG. Sometimes you get unusual EKG rhythms, you'll have different changes in your heart rate and your blood pressure. But there are also, even though they are quite small, some risks that involved like a heart attack, stroke, or even death. However, those risks are greatly minimized by your full disclosure of your medical history, and then we're going to be very carefully monitoring you during the test as well. Now, once your test is done, a cardiologist is going to review the results. They treat the results as privileged and confidential, and then the results are forwarded to your physician, usually between 24 to 48 hours after the test. And then essentially, do you have any questions or do you have any concerns for me at this point? No? Okay, so I'm going to have you, if you want, you can read over it again. Otherwise, I will just have you sign and date at the bottom. Perfect. All right. And then thank you so much for having your test done here at Harper College. We appreciate it. And then if you have any concerns or you need something during the test, just let me know.
Thank you.
Thank you.